Tonight on the program, our focus story is TileMate, local tile adhesive manufacturers out in Lobadze, whose products are stocked in over 150 hardware stores across the country. Led by founder and managing director Tumelo Sidira, TileMate was established in 2019 and started operations in 2020 with hopes to be leading suppliers of ceramic tile adhesive, porcelain tile adhesive, tile grout and bonding liquid. Before that discussion though, we sit down with pharmacologist and consultant cardiologist Dr. Kiran Bhagat to learn about lifestyle disorders. Welcome to First Issues. As a program that aims to sensitize, inform and educate, sometimes we come off as repetitive. Nonetheless, because we believe in our mission, we're willing to take that risk, which is why we have brought back yet another topic that has been discussed on the show countless times: lifestyle disorders, otherwise known as non-communicable diseases. The burden of lifestyle disorders has rapidly increased globally, making lifestyle disorders a leading cause of disability, morbidity and mortality. They account for about 41 million deaths globally, close to 3 in every 4 deaths. About 17 million people die from lifestyle disorders at the most productive age, with 8 in 10 of such deaths occurring in low and middle income countries. While lifestyle disorders mortality is declining in high-income countries, the epidemiological transition seems to be taking a toll in low and middle-income countries, which harbor 85% of lifestyle disorder-related deaths. Diabetes, cancers, cardiovascular disease and chronic respiratory disease account for about 80% of these deaths. More than that, lifestyle disorders are one of the leading causes of profit losses in most organizations because of resultant absenteeism, sick-offs and presenteeism. Even though these disorders are fairly common, information around them is still misconstrued. To help us shed some light on some of these is Dr. Kiran Bhagat, pharmacologist and consultant cardiologist.
Lifestyle diseases used to be known as non-communicable diseases, but I think the term has changed now as non-communicable disease generally affects an aging and elderly population. And what we've discovered with lifestyle disease, and literally it is the way you lead your life, is now beginning to affect a younger and younger population. And so lifestyle diseases are things that we've done to ourselves in the 21st century that are now coming back to bite us. And that really is what we're talking about in terms of lifestyle diseases. And they are beginning to affect people as young as 7 and 8, all the way up to 80, 85 years of age. And that's why it's a completely different kettle of fish when somebody talks about the non-communicable diseases, which are part of lifestyle. But as a result of the changes in the way we live, the way we eat, the way we don't exercise, for example, which we'll talk about, a number of diseases have come out which never existed before. And that is what lifestyle is. So it's the impact of how you behave on a day-to-day basis and what it does to your health as time goes by.
Let us further expound on your last point. What causes lifestyle disorders?
It's important for our listeners, our viewers, to actually understand that lifestyle disorders are intricately bound. You know, if one looks at a tree, for example, and there are different branches of the tree, but if you go down and follow the tree, the branches to the trunk and into the roots, those roots are intermingling. And so the things that we call lifestyle diseases, such as diabetes and hypertension and Alzheimer's and dementia and cancer, etc., all have their roots in a unified system of lifestyle ways and practices that we are all unfortunately doing that result in one or number of these illnesses. So, you know, the dice will roll as to whether you'll be diabetic or whether you'll be hypertensive or whether you get cancer. But the substrate, as we say in medicine, the platform on which all these lifestyle diseases manifest is based on the same principles. It's what you eat. It's whether you exercise. It's what your weight is. It's whether you take toxins like alcohol and smoking, substance abuses. It's your weight. It's all these things that ultimately result, and based on your genes, it will manifest in one or other lifestyle diseases.
Let us talk about lifestyle disorders in the context of Botswana. What does that landscape or demography look like?
It looks very similar to lifestyle disorders in the rest of the world because we've become a globalized culture. Most Botswana are now increasingly urbanized. And what we do in the city, whether it's in Gaborone or whether it's in Gauteng or whether it's in, Gabon, we eat the same things. We don't exercise. We sit most of the time. We're not consuming the things that our ancestors ate. We're not going out into the field. So it's an urbanized, industrialized, dare I say, Americanized way of living. And so we're also following what I call the SAD diet, the standard American diet. So we're eating more processed foods. We're eating more sugar content. We're eating less fiber. We're not burning our calories. And so whatever city we look at, whether it's in East or Central, North or Southern Africa, we're seeing the same disease patterns as our populations migrate from our rural areas into the urban areas. We see the rise in heart disease. We see the rise in blood pressure. We see the rise in stroke. We see the rise in cancer. We see the rise in dementia. We see the rise in stress and depression because as you move into the city center, you're losing the extended family. You're losing communication. People think that because you're in a city and you're with lots of people, it's actually not true. We know that people that are urbanized are actually lonelier because you're going to work and you're doing your business. You're going home and you're doing so you're becoming a very nuclear atomized family. And so the stress and the anxiety together with the lack of exercise, the unhealthy eating, the 3 meals a day, the not burning the calories are happening worldwide. And so that's why it's become a WHO agenda that lifestyle diseases are beginning to kill us. As we become more urbanized, more modernized, in a way, modern is probably not the right word, but perhaps more industrialized, we need to be aware of the mirror and look in the mirror as to what's happening to ourselves.
Perhaps at this point you could talk about the most common lifestyle diseases right here in Botswana, which will ultimately culminate into us having a very short series with you to further explain them.
In terms of lifestyle diseases, they are the very same that we see in whether it's Boston or Botswana, it's the same. And top of the list is heart disease. And heart disease has its basis on, again, lifestyle. And we'll come, our viewers will be actually tired of hearing the same things. But it is something that's really important, that what you put on your plate, whether you exercise, when you look in the mirror, what do you see? And what is your waist circumference? Have you had enough sleep? Have you eaten the right food? Have you exercised? What is your weight? Are the things that are going to influence your condition. So in Botswana, the commonest lifestyle diseases are high blood pressure, diabetes, obesity, cancer, dementia, and stress.
We're back with Dr. Bhagat next time as he kicks off a multi-part series on the most common lifestyle disorders, where we will be starting off with obesity.